This is IT and Genomic Medicine by Christine McCord. Imagine the day that you're born, getting a prick on your finger to give a drop of blood, which could tell you almost everything about your body and health. You would know exactly what diseases you are most susceptible to. You would know exactly how your body metabolizes food and medicine. You would know traits that you would pass on to your future children. And imagine that for the rest of your life, at doctor's visits, you could simply give blood and know if you have the most early stages of cancer or other diseases, have targeted and personalized treatment for any ailment, and through your DNA, know the exact changes going on in your body. Through scientific, medical, and IT advancements, this is exactly where the future of medicine is headed. Genomic medicine revolves around sequencing a patient's DNA and using that information in a clinical setting. This field has been progressing at an astounding rate over the last 20 years, and in the past few years, the technology has advanced exponentially. Just 5 years ago, a sequencing project could cost millions of dollars and thousands of hours of work, something that can now be done for hundreds of dollars by a single person. And this progress has been made possible with huge advances of IT in the field. The field of genomic medicine started in the 1950s when Watson and Crick discovered the DNA double helix structure. After that, the technology of sequencing sprang into life. Sanger sequencing was invented in the late 70s, setting the foundation for all the future sequencing technologies. With Sanger sequencing, they could discern genetic diseases, like Huntington's, and find cancer biomarkers like the well-known BRCA1 gene in breast cancer. The Human Genome Project first sequenced the entire human genome and identified all the genes in human DNA. The latest advancement has been the introduction of next-generation sequencing technology, which enables rapid sequencing of DNA and spans entire genomes, producing hundreds of gigabases of data in a single run. Today, there is more demand for genomic data for drug development, targeted treatments, early detection, pharmacogenetics, and much more. As the technology has progressed so quickly in this field, the issue that has evolved is how to store this massive amount of data. Genomic medicine has produced a change in data quantity and format and has forced IT to reconsider data management, storage, and visualization. Because there is so much data produced, companies and researchers are looking for affordable storage. Because the data produced will continue to multiply exponentially as sequencing becomes cheaper and more common practice, IT needs scalable data storage options. The promise of data integrity and stored data is very important, since the huge amount of data generated must be stored for years, as people learn more about the field and look back through it. Additionally, these DNA sequences are from patients, and so for patient privacy and protection, data must be extremely safe and secure. Most data is stored locally, but there has been some movement to upload genome sequencing data to cloud storage facilities. But usually limited bandwidth causes very slow and inefficient transfer of data, which is not sustainable with the amount of data at hand. A common solution is tiered storage, allowing some storage with higher cost technologies for fast access, combined with lower cost archival storage that is not as functional or quick and easy to access. One reason this storage issue exists is that the cost of DNA sequencing technology has been dropping faster than the cost of storing the data. Compounding this issue is the fact that companies and researchers rarely delete their gene data, because the more data you have, the more powerful algorithms you can use, and the more trends you can see across data, leads to bigger discoveries. The industry is thought to soon be producing yottabytes of genome data. IT will push to create innovative storage solutions as this becomes more data to manage than ever before. With all of this data also comes the question, how do we use it? The push now is to better be able to interpret genetic information. When a researcher has sequenced 10 or even 100 genomes, they are only seeing a small picture. To fully understand how genetic variants link to health, there will have to be massive sharing of information. Some of the world's biggest owners of genetic data, like the NIH and Sanger Institute, are working to make vast amounts of genetic information publicly available. This is through huge public databases that collect information about genomic variants and their relationship to human health. Combining powerful big data and discovering trends and commonalities between genetic data and clinical outcomes of the patients will lead to advancements in treatment and patient care. While there is nearly universal agreement that doctors and geneticists should exchange more data, movement toward achieving this goal has been slow. Researchers are often reluctant to share their hard-won information. People in the pharmaceutical industry, researchers in academic and other competitive fields do not benefit from sharing data, even if it's for a greater cause. Another dilemma is creating technical standards for sharing data. To combine massive amounts of data, it must be consistent to some standard. Another dilemma in the field is privacy and security of the data. Some companies, institutions, and clinical trials are legally prevented from sharing data, even if it is stripped of any personal information. This issue of privacy and security is very real. It is scary to think that someone could steal your credit card information, much less think that someone could steal your genetic code. There are laws in place for patient privacy, HIPAA, and laws specific to personalized medicine, GINA. The passage of the Genetic Information Non-Discrimination Act in 2008 barred employees and health insurers from using genetic information or family history. Still, it is concerning to many people to have such personal and sensitive information out there. With this potential for such great advancement are these very real ethical challenges about privacy, access, and ownership. Increasingly, doctors will have the complete genetic information of their patients. Right now, our ability to acquire genetic data has outpaced our ability to interpret and use it. For example, we can currently sequence a cancer patient's tumor DNA to determine exactly what genetic variants are responsible for their cancer. But this knowledge is useless as there are so few targeted treatments that can help. We will soon transition from merely possessing this data to actually understanding it and using it for patient benefit. The rapid advances in sequencing data generation suggest that we are still in the early stages of technology development in this field, and that data production will continue to increase dramatically over the next few years. Please consider these questions. Let me know your thoughts on genomic medicine and IT. Thank you very much.